Hello friends, welcome to a new lecture on seizures. It is a continuation of seizures, and in the last class we have learned about the generalized seizures, and in the before class we have learned about the focal seizures, and now we are going to learn about unclassified seizures and seizure syndrome. I would recommend you to watch the previous lecture for better understanding of this present topic. So in currently unclassifiable seizures, here we are not able to classify it. They are not focal seizures and they are not also generalized seizures. Then what are they? They are called as epileptic spasms. Here there is, if you see, the person has no focal or generalized. The person has sustained flexion. There is only sustained flexion or extension of the proximal muscles. Only the proximal muscles. It can be the shoulder muscle or it can be the trunk muscle. Even the truncal muscles, the abdominal muscles or the chest muscles, even they undergo sustained flexion and extension. So they may undergo sustained flexion or they may undergo sustained extension. So that is epileptic spasm. So for this we diagnose it by EEG. EEG have slow waves. Okay, and it sometimes may also have multifocal spikes and sharps. Okay, so this is about epileptic spasm. And now let us learn about epilepsy syndromes. So these are important for the multiple choice questions, in fact. So the first epilepsy syndrome is juvenile myoclonus epilepsy, which is JME. So juvenile myoclonus epilepsy. It is most common in adolescence, that too in early adolescence, and this is a generalized seizure, in fact, and the cause is unknown. We don't know the cause. Now here the person has bilateral myoclonic jerks. There will be bilateral, both the sides, and there will be myoclonic jerks. And these jerks are most common after awakening. Once the person wakes up, he may have awakening, or these are most commonly they are most commonly precipitated by sleep deprivation, or these two are the major causes or precipitating factors of myoclonus. Just after he wakes up, just after waking up, after 5 to 10 minutes after waking up, the person may have generalized seizures, which are most commonly bilateral, and they are myoclonic seizures. That is myoclonic jerks. So that is generalized, that is epilepsy. That is one of the epilepsy syndrome, which is juvenile myoclonus epilepticus. So these juvenile myoclonus epilepticus, if not treated, they may progress to, generalized tonic-clonic seizures, or 1/3 of them will progress to absent seizures. So we'll generally have to treat them for sure. And there is a family history of this disorder. Family history is also seen. So this is about juvenile myoclonus epilepsy. Now, the second type of epilepsy syndrome is Lennox-Gastaut syndrome. This Lennox-Gastaut syndrome, it is more common in children. So what are you going to see here? Here, number one, there is a triad. Number one, there are many seizure types. It can be, if you see, generalized tonic-clonic seizures, or there can be atonic seizures, or there can be atypical seizures, atypical absent seizures, there will be typical absent seizures. There can be multiple seizure types. And there will be impaired cognition. Okay, and then the person on EEG, they show slow spike wave pattern. That is spike pattern, slow and there is wave pattern. Okay, this triad, if the person has, then it is called as Lennox-Gastaut syndrome. Why is there? Why does a child suffer from this? It can be because of CNS disease or dysfunction. The CNS disease or dysfunction can be because of some trauma, some injury, or it can be infection causing meningitis or encephalitis or some infection, or it can be hypoxia or birth injury, that is perinatal injury, perinatal asphyxia. All these can lead to this Lennox-Gastaut syndrome. It has mostly poor prognosis. And the third type of epilepsy syndrome, which is important, is mesial temporal lobe epilepsy. So this is medial temporal lobe epilepsy syndrome. So what do you see in this mesial temporal lobe epilepsy? So here in mesial temporal lobe epilepsy, the main focus of epilepsy is the mesial temporal lobe. Okay, mesial temporal lobe is the focus of epilepsy. It is the focus of epilepsy. Okay, it is more common between 12 to 15 years, that is adolescence, and here the person has slow progressive decline in cognitive performance. So for example, the child, if you see, the child cannot learn new language, new knowledge. That is called as anti-retrograde learning disability. Okay, so here aura can occur, or there can be behavioral manifestations can occur. There can be memory loss. There can be post-ictal confusion. Sometimes there can be dysphagia. So it is a combination of many dyscognitive features or many types of convulsions, normal seizures. Most commonly it is early onset, but there is family history is present. Okay, so what do you see on laboratory investigations? In laboratory investigations you'll have to do EEG. It is mostly normal. Why? Because the lesion is in the mesial temporal lobe. So surface EEG cannot pick up the temporal lobe lesions. It cannot pick up the lesion, pick up the abnormality. So this is called as false normal. It's not normal, but it is falsely showing as normal. So we'll have to do MRI, but MRI in early stage. You see, earliest stage if you see, it's normal, but slowly there will be first hippocampal sclerosis, and this hippocampal sclerosis can progress to temporal sclerosis. What is the gold standard investigation? The gold standard investigation is sphenoid sinus electrode EEG. So you'll keep an electrode in the sphenoid sinus, and from there you will get the get the findings or get the impulses. So that is the gold standard investigation. So how are you going to treat it? The best treatment, remove this mesial temporal lobe. That is anteromedial partial temporal lobectomy is most commonly done. So this is about the mesial temporal lobe epilepsy. So these are the different types of atypical or epilepsy syndromes which are seen in people. So in our next class we will learn about treatment of epilepsy. How are we going to treat the epilepsy? We have learned the many things right now. So we are going to learn what is the treatment of epilepsy. So thank you guys for watching my lecture. Please subscribe to my channel for the next videos. Thank you.